All right, let's finish up this talk. This is the part that I am pretty sure I'm not going to have time for, but I want to have it, and so I can at least have it on YouTube, right? There's big questions now about how long immunity lasts. This has only been an epidemic in the US for 5 months now. And then we also want to ask, the people are feverishly working on a vaccine. What are our prospects for it? And you can get headlines like this, that the antibodies fade in as little as 2 months. And that sounds very scary. There's this one that just came out. CDC says that people are protected up to 3 months. That was actually accurate, but that sounds like I would rewrite that headline. So let me take that and let me say the real thing is that people who recover from COVID-19 are protected for at least 3 months. And we've just had 3 months to look at them. That's good news, and it sounds like it's bad news from the way that that's written. Let me address the antibody fading first. Antibodies usually fade from most infections, and especially for coronavirus infections. And honestly, there is a possibility out there that the antibodies will fade from this pretty quickly, and then it will come back. But the fact that we've seen antibody levels drop is nothing to make a headline about. In fact, it's completely normal. The memory cells are the ones who are supposed to remember. If you're not detecting memory cells and you're just detecting antibodies in the blood, well, your body's not going to make more of them. So it's not the body's concern. It's keeping the memory around, and it can make more anytime it wants. So this is normal to have antibodies drop like this. And in fact, what I'm showing you right here is not data from SARS-CoV-2. It's data from one of the cold coronavirus strains that was from the 90s. We've known this about coronaviruses for a long time. So the other question is, how do the branches of immunity hold up over time? Do they fade after months? And there's many papers that are just coming out now where people have looked at this over the scale of multiple months and have seen, in all cases, they're as strong as I could have expected from this. The news is as good as I could expect. Here's one paper, and I'm going to go through this paper exactly for you right here. This has all three of the branches that we were talking about. It has antibodies, it has memory B cells, and memory T cells. And you can see the underlined part. They did not only persist, but in some cases they increased over 3 months following the symptom onset. They're not going away. The cells still reacted. They gave the cells bits of virus, and the cells reacted to the bits of virus. Really good. We can do that in the lab. And in fact, they gave little bits of virus to people who had never been infected. And a little bit, they had cells that responded. And so it seems like this goes along with the research that I talked about previously. Bunch of data in this. This has multiple branches of the immune system. Here's the antibody data. Blue is up, and blue means good. You see the data 1 month after infection. A lot of blue, a lot of up. 3 months after the infection. Do you see any difference? I don't see any difference. The blue is still up. There's still antibodies 3 months after the infection, the way that they measured it in that lab. So we move on to the memory cells, the B cells and T cells. Up to one, they're up as well, measured 1 month and 3 months after infection. Here's the examples of the B cells, and the T cells are on the bottom. My main thing is I want to show you that you see those numbers are up. Those points are up on that graph. That is good news. They're definitely up, and something is going on. Your immune system is remembering. The MBCs right here, they're boxed in red. Those are memory B cells. And when I say they're remembering a virus they have not met, the two rightmost bars, where you see the bigger red bars, those are in the COV-2 infected patients. But the other bars, the HC, means healthy controls. Those are people who had not been infected. They had not had the pleasure of meeting the virus, and yet they still have some red bars. They still have some reactivity. It's a lower level. You can see that it's definitely a lower level on the farthest right graph over there. But it's there, and we just don't know how big it is. We don't know. There's a faint possibility that it could even be a bad kind of immunity, but I don't see any evidence of that, and I'm not going to worry that it's a bad kind of immunity until I have evidence that it's a bad kind of immunity. This is coming out in other places. This is in Cell, one of the biggest journals around. And I just want to show you this graph. They have T cells and antibodies. See, those values are up in several different people who are just exposed, people with mild disease, people with severe disease. You do tend to have more immune cells and more antibodies if you had more severe disease. But a lot of different people in a lot of different levels do have them. And so there are strong responses in the infected, and there's even some response in the uninfected. Honestly, as an immunologist, I couldn't be happier. China's had more time, and they just published a paper where they looked at patients 6 months after infection. 6 months after infection in China, they saw high levels of immune responses. This is a quote from the paper, that they say that they observe prolonged immunity. So the news is good. And basically we have to look past the headlines, and we can't always trust that the headlines, they're copying each other. They're not copying the original data. They're copying each other, and to some extent they're copying a poorly worded CDC report. But even the CDC report is closer to the truth than those headlines are. So this leads to, what are the prospects for a vaccine? Now, the idea behind a vaccine is the virus is this complicated pink and purple thing. And the virus as a whole will infect and replicate inside your body. But remember that the immune system only needs part of the virus to recognize it. You can recognize one of the cousins from just their face. The immune system might be able to recognize this just from the pink protein. So the whole idea behind a vaccine is that you break apart the virus and you give the broken bits to the immune system, hoping that they will be enough for it to recognize. It's kind of like showing them a picture of the virus instead of the virus itself. In many parts, in many cases, this works. And when you have a virus that provokes good immunity, a vaccine is more likely to work. Okay? The immune system just needs a few of the parts, and there are many different ways to break apart the virus. This is a good example of 4 different ways to break apart the virus at different levels. You can have a whole virus that's broken in some small way, or you can have just a bit of the protein that you give to the immune system. You can even give the immune system just the RNA. And this is a really cool idea that's just working right now, and it looks like it's working great so far. We have a lot of things, because when you're giving something that looks like something dangerous to the immune system, to the body, you have to make sure that it's not actually dangerous. And that's the whole idea behind vaccines. But the vaccines have been being used for hundreds of years, and there have been lots of diseases that they've dealt with. So there are coronavirus vaccine trackers. There are literally hundreds of vaccines being run against this one virus internationally. And so and they're moving through. Now it's going to take time and patience, even in this case. But what I really want to get down to is, what's the big question? The big question is, how should we plan for the future as teachers? And I want to say 2 big takeaways that I want to say. As educators, I want to plan for a winter resurgence. I really hope, and I'm praying this doesn't happen. But I've got to say, almost every respiratory virus gets stronger in the winter. The only exception was the original SARS-CoV back in 2003. But that might have been squelched from the beginning. Going from what we know, 95% probability that there will be some kind of winter wave. And also, when you have it happening in the winter, you have co-infections. And that's where we really don't know what's going to go on. Co-infections can be good, or they can be bad. The viruses can team up against you, or you can learn from one virus to take out the other one. We don't know until it happens. There are some signs that different viruses are going to be good or bad combinations, and there's some scientists working on it. The bottom line is, this is going to be really hard to predict. We have to see what happens. We have to see how many people are getting sick, who's getting sick, and ask the question of how can we slow this down so that our healthcare system can manage it. The second thing I think you should do as a person, I think you should get a flu shot. Yes, it's a totally different virus. But remember the cross-reactivity with the common cold. The immune system is deliberately messy. It likes to recognize cousins. And there are some arguments that you can have an immune system that's generally boosted against viruses. There's a lot of pseudoscience that uses that same terminology. But there is something to the idea that you can rev up your immune system with one thing and it will defend you against another. So that's what I want to say this year more than anything. And I know that the governments are preparing for this. Make sure you get your flu shot. It could protect you from more than just the flu. At the very least, it could protect you from the possibility of co-infection, of influenza with this virus. So give it a chance. These are the data for the 4 common cold viruses, the respiratory viruses that I say peak in December. And my school has responded to this. Notice that by month, you have those lines going way up in month 11 and month 12. These are the cousin viruses, so I would expect, if anything, SARS-CoV-2 to follow this trend. This means if you can get done by Thanksgiving, that gives you a good chance of at least getting through November before having to maybe do the last couple weeks of classes. So one of the things I did, I have a 3-week computer lab that can be done by the students remotely. Usually I do that in the middle of class. This year I've moved it to the end, and my entire institution has wisely moved our quarter system to be, instead of being done in early December, we are now going to be done before Thanksgiving. I actually feel pretty good about this plan. And in fact, signs are that the virus is on the retreat right now, and the only question is when and how will it come back. So let's keep an eye on this. Notice that it's a long time till November, and there's a lot of unknowns. I want to remind you of the parable of the farmer. There's lots of seeds growing. There's bad seeds, but there's also good seeds, and there's immune systems learning things. So we've got to know that those seeds are out there. We don't know the effect until we step out in faith. Remember the letter of James, and I think that this is James remembering some of the things that Jesus said. Be long-suffering until the arrival of the Lord. The farmer awaits the precious fruit of the earth, remaining patient over it till it receives the early and late rains. You be patient too. Strengthen your hearts, for the Lord's arrival is near. Patience and humility require a kind of strength that the world can't see. And so I want to pray that you have the strength and humility, that you can wait and see what God will do. And I pray that God's future will be even beyond what we ask or imagine, in the small, hidden way of giving life that God gives. All right, with that, I will leave these questions open for discussion is what I'll go to. But you can discuss these in the comments, I suppose. That will end my dress rehearsal.